Hi everyone, this is Neil Wright, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with bilateral dead skin plugs. This is the patient's right ear that we're commencing with. And do stay tuned till the end of the video. I have got a still image of all the wax and the dead skin that I extracted. And as you can see, they've got quite a few hairs at the entrance of the ear canal, which is entangled with this dead skin plug. I'm saying it's a dead skin plug as opposed to wax because you can see it's highly reflective, which is more typical of an epidermal plug. So dead skin contains keratin, and keratin is a protein that's also found in our hair strands, fingernails, and it's highly reflective. One of the benefits of keratin actually is to reflect away harmful UV sun rays, and keratin just adds a bit of strength, rigidity to the outer layer of skin. It's also hydrophobic. So dead skin also contains other compounds called natural moisturizing factors, which are there to absorb moisture, because of course we want the epidermis layer of our skin, the most superficial layer, to be hydrated. But to prevent it from overhydrating, keratin is hydrophobic. So it kind of provides a balancing act with for the outer layer of skin. If there was no keratin, then it's very likely when your epidermis layer of skin comes in contact with water, it overhydrates, which causes the skin cells to swell and burst at the membrane, so it macerates the skin. Now, I used a bit of suction, so now I've reverted to the right angled ear hooks. So there's a bit of an opening at the roof of the ear canal. We just carefully glided in the hook horizontally before rotating it to embed the tip within the keratin plug. Now, although the hook didn't extract this plug in one piece, it did break it up a little bit, and I've gone back in with microsuction now, and I think I managed to get this in a plug. We shall see. Or does it come away in two parts? Well, that part flaked away, but I'm pretty sure this comes out in a plug now. And the reason why I know that is because I've got two plugs here as part of the still images. So this procedure was performed a few weeks ago, so I can't recollect exactly the individual details, but I do have the still images, and by virtue of the fact that I've got two big plugs, I'm pretty sure this one here is going to come away in a plug, which it has. So I'm just going to use the side of this left-hand side spec to push away those hairs. Going to get the eardrum in focus. All looks pretty well. It's pretty deep. You can see where the plug was up against the wall. It's a bit of vascularis of the medial canal wall, and what I mean by that is some dilation of the blood vessels, capillaries, the base of the ear canal. Sorry, the apex end, so the medial end towards the eardrum, which has made the ear canal a bit red. So we know this plug has been compressing against the ear canal wall. So just moving on to their left side, again, it's highly reflective. I could have, watching it back, just reduced the brightness slightly, but it wasn't causing me an issue. When you've got loads of hair, and actually, you can see there, I've just reduced it just to get rid of that glare reflecting from the hairs. So I second guessed myself there. This side is a bit more tricky because at the entrance of the ear canal, and I do remember it now that I'm watching it back, there was so if you're going into the ear, there's a step down. So as I'm bringing the wax out, it's a step up. Managed again to get the angled right ear hook embedded, and that's one of the benefits of our right ear hook, whether it's the straight version, the 2-in-1 straight version with the correct, or the angled version. It's more tapered, the tip, compared to your traditional St. Bart's ear hook. So St. Bart's ear hook, sometimes you couldn't embed it into the wax or the skin, whatever it may be, and instead you're just pushing it down against the floor of the ear canal. This ear was actually a lot more bendier. That's another thing that I can remember. It's strange how when you watch videos back, you can recollect the procedure and a bit more information about the patient. So again, just tucked away behind the first band where all these hairs are, we've got some skin. I'm just going to peel that off the the lateral posterior canal wall. So when I say lateral, I mean near the entrance, and posterior will be the back part of the ear canal. I've just rotated the specular in a different orientation so we can push some of those hairs out the way at the back of the ear canal where the first bend is, and that's the eardrum, a bit narrower, a bit more bendy. I couldn't tell you which plug is which. I'm assuming this is their left side and this is their right side, the first ear, and you're going to have a combo image of all the dead skin that I've extracted. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.